community representatives, our partners, distinguished guests, ladies and gentlemen, good afternoon. It gives me immense pleasure to join you this morning to commemorate 40 years since the first case of HIV being detected in Kenya in 1984. This World AIDS Day is special to me as the celebration is critical to shape our discourse for the now and future generation who may have not had the chance to see and experience the epidemic in its worst case. We all recall the experience on our continent, the early 2000s, a negligible number of HIV-positive clients had access to diagnosis and life-saving treatment. On the health facilities, they were swarmed with dying patients, and doctors struggled to give their best to manage the onslaught of devastating opportunistic infections. Homes were filled with graves, orphans who were helpless filled our communities and our country, and all sectors lost a significant workforce, and the stigma in the communities was at its highest. It was devastating at that time, even as was said by Dr. Rose. HIV and AIDS crisis that threatened the social, economic, and development fabric of the country, and the emergency situation called for out-of-the-norm action. The ravaging epidemic at that time threatened to wipe out communities if nothing was done, and done very fast. The Kenya government declared HIV/AIDS a national disaster in 1999, resulting in a national move towards creating awareness and advocacy for prevention of new infections. And globally, multilateral investments through PEPFAR. Thank you so much, Brian and your team, and really we appreciate the great work and for standing with us throughout this. I have seen practically, even working in the HIV programs, what you have done, and we really appreciate your support, and equally for the Global Fund, who are really instrumental in terms of supporting us to reduce the HIV infections in our setting. Since 2003, the government and its partners have built the essential mechanisms for HIV/AIDS management and strengthened public health systems, which we even leveraged on during the COVID-19 pandemic. And I want to assure Kenyans and partners that we treasure and we will guard the gains made over the years. Today, Kenya has an estimated 1.4 million people living with HIV, with an overall UNAIDS target of 98, 97, 94. As of the end of September, 1.36 million people living with HIV were receiving HIV treatment in Kenya, and there are 3,752 HIV treatment sites, over 2,000 that have been digitized, and over 8,851 HIV testing sites encompassing public, private, and faith-based organization-supported facilities in the country. 90% of people living with HIV on treatment are on the digital platform, and a majority of people living with HIV, that is over 90%, receive care at level 2, 3, and 4, and specifically 21% of people living with HIV are cared for at level 2 facilities, with 27% at level 3 and 45% at level 4. We are also on course with decentralizing high-technology lab services for DNA PCR, with 2 counties, Kisumu and Migori, already onboarded. Within the last 10 years, there has been a remarkable decline in new HIV infections, HIV-related mortality, and mother-to-child transmission by 83%, 64%, and 65% respectively. As a result, people living with HIV today engage in social and economic activities and are core partners in the response. It is the strong partnership and collaboration with every stakeholder here that has transformed the response and made these remarkable achievements. Exciting innovations such as long-acting injectable ARVs for HIV prevention, self-testing, and integral role of affected communities in the response are transforming our approach. Coupled with education and primary prevention efforts, these breakthroughs give us a glimpse of a future free of new infections. So, ladies and gentlemen, while we celebrate, we note that there is need to address a few gaps. One of them being new HIV infections among children and outcomes of children living with HIV and in care, which is still below the UNAIDS target, as has been clearly reflected by Dr. Masha. the men and young people living with HIV have not met the UNAIDS targets, there is an urgent need to address the gaps for their own health, but also as key pillars in addressing the work of ending AIDS. We are happy with the DREAM initiative, 000, but then we need to have something that has been customized for the men and the young population. And so we hope that the team will take it up and address it. Again, geographical disparities. We've seen the 10 counties, but we see that there's disparity in progress, which requires our thinking and response in the undeserved counties or underserved counties within our country. Among those already in care, as has clearly been said by our NEFAC colleague, we have people living with HIV having long-term or chronic illnesses, non-communicable diseases, issues of reproductive health and mental health. And so we need to see how to integrate those within our care and treatment. And specialized labeling of standalone HIV comprehensive care clinics, again, they contribute to stigma and discrimination. And that's why we are thinking, how do we ensure that we incorporate it into the sustainable Taifa Care program. So ladies and gentlemen, Theodore Roosevelt once said, being a good citizen demands honesty, faithfulness, and courage, virtues that are equally critical in this battle. We must come out of the emergency mode. It is time we had honest conversation on self-reliance and charting the path to a sustainable HIV response, as has been clearly been talked about by PS Kim Tai. So in the coming year, our focus is to evolve and realign the HIV response through relevant legal and policy tools and plans. This will guide national and county efforts towards achieving self-reliance in the HIV response by 2030. Key reflections include strengthening of financing model, governance and government institutions responsible for HIV, and building on His Excellency the President William Ruto's health reforms under UHC or Taifa Care through the primary health care strategy as the anchor for the transformation of the HIV program, and guided by WHO framework for integration of services and health system blocks, including human resource, commodities, data and information system to increase efficiency, promote equity, and maximize resource utilization. Support of operationalization of the Social Health Authority that includes HIV prevention and control in the essential benefit package as a key tool to sustainability within the context of publicly financed primary health care is really critical. And the great news is clinical encounters for HIV, non-communicable diseases, and advanced HIV disease will be captured in this new model. And I urge all people living with HIV, let us enroll, let's get registered, let us contribute according to our financial capacity. Utilizing Kenya's enormous potential for local manufacturing of pharmaceutical and healthcare products, again, is really critical. Dr. Rose was sharing with me that the commodities would cost up to 27 billion. And that is why we really need UPEPA this time, even as we transition. But for us as a country, let us think of sustainable solutions. Let us leverage on the manufacturing industries that we have and see how we can have local manufacturing. Thank you, thank you. He understands local manufacturing of ARVs within our country. So behind every statistic, we know that there lies a life story of struggle, resilience, and hope. And today we honor those who have succumbed to AIDS and those who live with HIV and the communities, families, and individuals who stand with them every day. I also wish to acknowledge with admiration the efforts and immense contribution from the national and county governments, the partners including UN, PEPFAR, and Global Fund, the media, religious leaders, communities, CSOs, among others, who have been really supportive even to this. And we hope even for the last mile, a race to end AIDS, your support will continue. Last but not least, I want to acknowledge NASCOP and NSDCC, the key institutions in my ministry that have ably driven this progress. Let us continue with the synergy within the ministry, the various sagas. You see SHA is now here, so it really calls for the ministry to work in collaboration and synergy. During his address to the nation last week, His Excellency President William Ruto reiterated his commitment to providing universal health coverage that is under through the flagship health reform initiative, now known as the Taifa Care. And on this World AIDS Day, let us commit to being part of these reforms, learning and listening to one another as we make progress towards perfection. Together, we will break barriers to health and create an inclusive society in Kenya where everyone, regardless of their status, can access quality, preventive, promotive, and treatment services, especially the poor and vulnerable. And so the Taifa Care reforms are critical in this juncture. It is a bold step towards equalizing and health services and ensuring no one, absolutely no one, is left behind. Our collective unwavering support and collaboration have saved lives, restored families, and it is the same spirit that will secure the hope of an end to AIDS by 2030 and drive us to self-resilience. Thank you very much.
All right, asante sana. A big round of applause for Waziri. Asante sana. And CS, just with your, if you indulge me, please, I'd like to guide you to that podium. That's a place where we're going to do the launch. And the executives in the front row kindly flank the CS over there. You will get a pair of scissors. That's where the official launch will be. I'm buying time for my media guys so that you get the perfect shot there. We said in God we trust. Everybody else must bring evidence, videos, and M-Pesa messages, all right? So this is going to happen in the next short while. We are launching 2 documents, a decade of progress in the country HIV response, and also Kenya's operational plan for enhancing country readiness to sustain the HIV response to 2030 and beyond. Now, the operational plan outlines Kenya's roadmap towards a country-owned HIV response. As they still line up over there, I'll be showing you videos on the screen so that you see what the documents are all about. Kindly make sure you have a bit of space there, so there are some pyros that will come up. So make sure you have some space. All the dignitaries over there will be counting. We'll count down from 5 all the way to 1, but just make sure you have enough space so that there's pyros there. There's a bit of heat, so kindly step back a bit. To all my dignitaries, just step back and I'll count. I'll count before you count officially, so just step back to avoid the pyros. All right, in 5, 4, 3, 2, 1. There we go. And DJ, yes. Makofi. There you go. We're launching 2 documents there. They're right on your screen as well. Yes. A decade of progress in the country's HIV response. Once you have your hard copy, and then hold them up for a quick photo session. Just all of you come and line up the front over here. Once you have your hard copies, tafadhali, all the dignitaries just line up the front up hivi, so that we get you all in front of the cameras, and then hold them up and smile. In 1, 2, 3. All the dignitaries just come and line up over here with your hard copies, spread out. You want them up? All right, there's a request from the media people that you come up to the podium. Okay? That's all right, just come up to the podium. All right, let's have the dignitaries line up here. Dali, and then hold up the books. And we'll be counting in 3, 2, 1. Ensure it doesn't cover your face. All smiles in 1, 2, 3. All smiles at the back there. Yes. 1, 2, 3. Let's get the pictures. Another moment there. 1, 2, 3, 4. And we should be good to go. Asanteni sana. All good. I'm always biased to my media people because we come from the same side. Are we good? Great. Allow my dignitaries to come down, and then I'll call upon Douglas Bosire. Douglas Bosire to come and give a quick vote of thanks. DJ Punguza Kidogo. As the dignitaries settle down, let me call upon the World AIDS Day 2024 Planning Committee Chair, Douglas Bosire, to give a quick vote of thanks.
Thank you very much, Trevor. The Cabinet Secretary for the Ministry of Health, Dr. Deborah Barasa, and the entire entourage of government and non-government actors that have accompanied you. Gertrude Stein, an American poet, once said that a silent gratitude is not very much useful to anyone. And we take this opportunity, therefore, to just come to the podium to thank all of you for having turned up and turned up in large numbers, not only in the planning process, but also in the commemoration of this very day. We sincerely are grateful that, Madam Cabinet Secretary, you took your time and came to launch this half marathon about a month ago at the Landmark Plaza. And actually, today you are here to witness the marathon itself. Makofi ya waziri tafadhali. We appreciate you. We appreciate your principal secretaries, Dr. Ari Kimtai. We appreciate Mama Mary Mudhoni. We appreciate the DG. We appreciate the entire Ministry of Health. We acknowledge the support that you have gotten from the NSDCC board, led by Chairman Geoffrey Gitu and the CEO and the entire board of directors, because you gave us a chance to plan for this event. And I think we have not done a very bad job. Where we have missed, before all these people, we asked we be a bit lenient. Musahau tu hiyo kidogo, msikaangalie hiyo. Mtuache siku moja tu, hata waziri amesema sawa. Thank you. The Nairobi City County, they were here. Madam Waziri, we had 1,000 community health promoters from Nairobi City County. They were here with us today. The CC member is out of the country and she had sent apologies. But they are with us and we work very, very closely with them. To our heroes and heroines of the HIV response, the communities of people living with HIV, the communities of adolescents and young people, the communities of the key populations. Makofi kwa tafadhali. They have stood with us, and you saw during the cake cutting here, they came, they danced, and they sang for the prosperity of this country. Our development partners, both bilateral and multilateral, Dr. Stephen Jackson was here shortly, PEPFAR is here represented by Brian Reitman, and all of you, the Global Fund is here as well. Thank you very much. We really sincerely appreciate. The KCM chair, your KCM team was here today. Asante sana. Thank you. Our implementing partners, both from the state and the private sector, Dr. Kinyanjui is one of them. And allow me, Madam Waziri, although we are short of time, but allow me to quickly mention some of the partners that we have worked with, because this is the multi-sectoral response that we are building, because we cannot do it alone as the health sector. Athletics Kenya, who have managed this thing with us, we did not know where to begin. But AK held our hands. They are represented here, Ondieki is here, and their chair was here, Tabut. You could see, even they showed us how to shoot the blanks. Yes, thank you very much. PS Kenya, Antol Plus, Huduma Kenya, Sports Kenya, who are the, who are the owners of this stadium. Ministry of Foreign and Development, Ministry of Foreign Affairs, and Ministry of Foreign and Diaspora Affairs, Maybets, AHF, Kenya Medical Training College. The CEO was here and he ran with you. Mount Kenya University, Kenya Urban Roads Authority, Kenya National Highways Authority, Kenya Medical Supplies Authority, AMREF, UNICEF, Pepsi. The Pepsi gave us 30,000 bottles of water. Clap for Pepsi, please. Thank you very much. PHDA, TV47, Africa Heart, Anti-Doping Association of Kenya, ADAC, Guru Nanak Hospital, CIFAO, the ones, the Toyota people, they gave us the lead car, which was also timing the athletes so that we could know who won fairly. National Police Service, National Youth Service, National Police Service, and National Youth Service, Madam CS gave us 500 officers. From yesterday night, they have been at work, and they are still at work. Makofi kwa National Police Service, and anyways, thank you. LVCT Health, NEFAC, USAID, Ampath, Uzima, Medionics, Equity Afya, Lions, Nairobi West Hospital, Kenya Pipeline Corporation, and I think the CEO of Kenya Pipeline Corporation is here. Kenyatta National Hospital, UNAIDS, CEB Kenya, OraQuick, NCBA, Kenyatta University Teaching and Referral Hospital, Blue Shield, Kenya Red Cross, Bwana PS gave us 12 ambulances. 12 ambulances, and they have been with us today. Thank you very much. NASCOP, Dr. Rose, you are here. Thank you for giving us your team to plan with. NACADA, the CEO of NACADA is as well here. Asante sana for this journey. of ensuring the health and well-being of men and boys. The members of the Fourth Estate, the media, they are the ones who have reverberated this story, and they're the ones who made the people aware about this activity and therefore register. Our able MCs for the day, Trevor and MC Jesse. Makofi kwa Trevor and MC Jesse tafadhali.